Thank you. We have now time for a general discussion, and it's interesting when people in the room want to share their experience of developing technical aids for this problem. Are there any more persons in the room that would like to share their experience of developing apps or something with us? Yes, please, could you present?
My name is Urszula Wojtowicz. I come from Poland. I'm a PhD student at Jagiellonian University Medical College. My research focused on pelvic floor disorders using telemedicine. I finished my study. The title of my dissertation is Prevention and Treatment Pelvic Floor Disorders using Telemedicine. But in my project, I cooperate strongly with engineering with Stanford University. So in my project, I used a device. This device is vaginal probe, and this probe connected with our application. So in my project, women, patient with urinary incontinence, daily supervised by physiotherapist and gynecologist. So I monitored all biomechanical parameters like strength, endurance, control. We motivate these patients. So in my projects, it's really important to supervised by a physiotherapist. And this device is really helpful to women.
Thank you very much. It's very interesting to see that we have apps that are developed within the specialist care with devices, and we have apps in primary care, and we have apps for the population, because the populations are so different. Are there any more? We have heard of you, Marika, we have you, and we have heard of you. Are there any more here in the public that have developed some technical aid? You have? Okay. But you could give a short comment, Marika.
The last question, I think that's the most important one. And that's, for us as physiotherapists, the biggest task, how to implement it for the long term. So your study is ending 12 months afterwards. So I really hope that these groups will keep on following, because that's the most biggest problem we have. We can motivate, we can do whatever we want. Yeah. But it's ending after a year. I really would recommend that you go on following this group, because it's the motivational part. How can we keep these women, put it like toothbrushing or whatever? And that's what Borrello already said in his study. You have to implement it in your daily life rhythm. And we cannot all provide, not in my app, not in any app, provide in something like that. So that's my biggest concern for the future. And that's, I hope that technology people can find a way to do that. So also.
You will send SMSs to the shop 10 years after they have started.
Yeah, but sometimes, I need to do it.
It's a very good point, because we really lack long-term studies. There are too few long-term studies concerning the effect of pelvic floor muscle training. We really lack that. Well, you had something you wanted to present, an application or something? No, but if you have time, it would be interesting to hear. Because it's so good to realize that many people work with this problem in different ways.
So similar to Ulla, we have also developed an interactive device with an app. So I think if you look at the phenomenal success of the Fitbit gives you continual information all the time about what's happening. And you can like it or not like it, but it has been very motivating for many people. And I think women need that individualized feedback about what's happening. So an app, unless you have contact like with Marika, that she gives feedback and interacts with patients with their app as well, and some of you probably do that as well. I think for many women that don't want to go to a GP or a physio or something with their incontinence problems or prolapse problems or anything, they don't know if they're doing it properly or not. And we as clinical health providers know that there's quite a large percentage of women that cannot do a pelvic floor contraction. And as much feedback verbally as you give them, or as many tips, they still don't know. Am I doing it correctly? Am I not doing it correctly? So I think in who gave your user feedback, you found that women wanted to know whether their training was being effective or not, right? So I think that's an important component, and to have some sort of mechanism where they can get some feedback. So what we're looking at is using a wearable device. So not something you have to take time out of your day. You can wear it.
Okay.
And it'll give you information about what happens when I run and I leak. Why?
But
what happens
you
when I
wear
go
it
to
in the vagina, you mean, or? Okay.
You wear it, yeah. So,
Okay,
and I think that's for the it might be a consumer thing, but there's also a possibility to link that information with a clinician should you want to.
Yeah.
So you can provide that feedback to your gynae or your pelvic floor physio, your GP, whatever you want to. Or you can be an online community, you know.
It's very interesting.
Am I doing better than my neighbor? How many can you
It's
do
very
today?
interesting with this thing. How do you learn to identify the correct muscles? I mean, for us, the most important thing was the outcome with incontinence. But the women in the study, they said that they had no problems about. And I think there are studies now that show that most women can identify their correct muscles, but part of them. Yeah, it depends. If you're in specialist care, perhaps there are a few, but out in the population and primary care, big. No. But that's also one very important research issue, I think, to see if it's possible for women to learn how to contract themselves even in other settings. I don't know, how do you check that? Or do you check it?
So we don't check it. We also look at the outcome measurements, so the effectiveness or the severity of incontinence. So it's just the
because we
advice.
regard that the most important thing for the women that seek our care, it's that they want to get rid of their incontinence, not that they want to measure their muscles or something. But yeah.
I would
Please go
like to say two things
Yes.
from the practical side. These devices, they're connecting with Bluetooth, for example, to a mobile phone. The idea is good, but tell me the thing, how can I encourage the patient to insert this thing in the vagina?
Yeah.
Because sometimes these devices are big. Okay, and in my office, patients sometimes say, no, I won't put it in my vagina, and they feel shy, and sometimes they feel shy to talk about it. This is the first thing. And the second thing is the price. So we were talking about equity of the patients. There are patients who has mobile phones and iPhones, and none of these patients can manage to buy this device, I think, because the price is not for everybody.
Okay. So maybe there are also cultural differences, I don't know, but I think in our country, well, we haven't asked them, but I don't know. On the contrary, yes, it might differ between settings, yes.
Yeah, we have a project economic from the European Commission Horizon 2020 grant for develop project with a combination of vaginal proof and application. And well, at the stage we have some questions that maybe with experience is from the qualitative point of view. From the qualitative point, I think the key point is the different women attitudes to this. I think it's key. One is severity, very light incontinence. I think these kind of systems work perfectly well. But if we want to substitute to complement a physiotherapy treatment, I mean, in a serious incontinence, we need, I think, have a regular appointment with health professional. If not, I am sure that because the evidence we have, the level 1 evidence is that it's working when you are supervised by so from qualitative point of view, what is your impression about that? We have different kind of women attitudes toward to be sure that they need to be sure that they are doing well, perfectly well the exercises, and other women who feel confident.
Yes, I totally agree. So I think that's also an important issue for for the whole medical field, this more individualized health care, that women have different needs, and how can we, with these kinds of solutions, how can we help them select the right kind of solution? Maybe you can start with this treatment. If it doesn't work, you go here, and of course, yeah, they have different. And also women who entered our studies, they were searching the internet for apps. That's how they found the app. So they were interested in the first case. I mean, there are women who do not search the internet so much, and they might want another kind of treatment. So, yeah.
I think an important thing will be in your project to develop a screening questionnaire at the beginning to try to select this kind of as we select severity, to have an instrument that can select the women who are very prone to use this without any need of a health professional, and other women. And I think it will be very useful, and we will be, maybe your results will be even better if the women and in other case we don't lose time in women trying to do biofeedback or vaginal things in women who feel very, very confident with that. So it's possible to develop a kind of screening, short screening questionnaires in this kind of situations?
Well, we haven't done that, but of course you could have some kind of entry point where women enter, and then they get information about different treatment options, and then they can choose, and you could try to follow that. It might be a little bit more complicated, that kind of study, but of course it's possible, yes.
I think it was quite interesting, the results here. Yeah. That many of you like games, I think. We haven't tested that, but it's an option. You had some sort of game, was that so?
In our app, we have a graph that shows the number of exercises. So that's not really a game, but we have the P button. So people who have urgency incontinence can push the P button, and then the results will be in the graph too. And we have so it's like a game for the urgency incontinence. When people need some distraction from the urgency, they can hit another button and they go to the game, and there's like the two different movies. One is with the 3 cups and the little ball that goes beneath the cups, and you have to follow the cup with the ball. And the other one is I had an image with high buildings with a lot of windows and cats, and they have to count the number of cats that comes up behind the windows, and this will give them a distraction when they have the need to pee. Right.
There is already a big world in this for children. Contracting that the train is coming on rails.
Yes.
If they stop contracting, the train will stop.
Yeah. There are lots of games under development as well, I think. And it was also very interesting that only 41% thought that having regular appointments with a healthcare professional would motivate them to perform PFMT regularly.
In the Netherlands it costs money. So
okay. Well, I think it's time to finish this workshop. And I must say it has been so exciting to be chairwoman for this session, because you were all very active, and that's very appreciated. And I also thank my participants here very much. And please continue with the development and the use of mHealth and more research. Thank you.